La, 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 la.
All right, so can you tell me a little bit about the course that you just completed in tropical medicine?
So I completed the course in the Liverpool School of Tropical Medicine and Hygiene, and it's a 3-month course covering sort of laboratory sciences, theory, public health, and clinical sciences, all to do with medicine in the tropics. And more.
Yeah, I did the same one in London school, and it was very much, it's the same basic training, and you can do different courses around the world, and they just equip you to be working in developing countries where there might be a less well-developed infrastructure for health services and a kind of pragmatic approach to healthcare when you've got less available.
Yeah, and it's quite gears you up to be quite practical to deal with situations with not necessarily the right medications
Or
the
investigations.
right equipment, so you can kind of make do with what you've got. You've got the skills to make do.
You've got
with
to
what
do
you've
the
got.
best with what you've got.
Yeah.
Really.
Do you think your experience here in Jamaica has been beneficial for your own professional and personal growth as medical practitioners?
Yeah, massively.
Absolutely, yeah.
Massively, definitely. I mean, in England, we're normally pretty much babysat with sort of a massive team of nurses, massive team of doctors around us to help support us. But here is we've had some great support from the community and Tia, the nurse.
Yeah.
But we've had each other really. But we've been making decisions kind of.
And
based on
referral, you'd refer a lot of people in the UK, wouldn't you? So you might have a new diagnosis of diabetes and you'd refer them to the diabetic nurse, maybe to have blood tests to check their kidneys, to an eye, doctor to check their eyesight. They'd have loads of other services available to them, whereas here you're kind of having to be a one-stop shop for people. They might only get to come to the clinic on a one-off opportunity, and the rest of the time they're in the bush or sometimes very far away. People travel a long way to come to the clinic, so you have to try and provide everything that they need on that one visit as much as possible with limited resources.
And that's been really educational for us.
Yeah.
Although we've done internal medicine, or we are doing internal medicine training, just sort of family practice and
being a bit more holistic.
Being holistic and knowing a little bit about everything, that we've kind of learned a lot as we've come over the last 2 months, really.
I think knowing the patient, you get to know people quite a bit better here, because we live in the community and we've been here for a couple of months, and it's not a very large community, so you get to know your neighbours and you get to know what their problems might be and what they might
their
need
social
from you.
context
Yeah.
of their problems as well.
And obviously there's a fly on you now. That's been very rewarding.
Yeah.
I'd say it's been very enjoyable.
People know us as the 2 English doctors, and they stop you in the street and they come up to you and chat, and it's nice to have that connection, like a personal connection, not only a professional connection, but to have a
With the
personal
community.
connection
Yeah.
with the community. Yeah.
I mean, do you think the work that you've done here in the Blue Mountains has been beneficial to the community?
Ooh, I wouldn't like to say.